Welcome to the second week of what you need to know about catatonia and ASD. Catatonia involves differences in posture, speech, mood, and behavior. Autism involves the exact same things, differences in posture, speech, mood, and behavior. So we talked a little bit last week about how it's difficult to recognize when catatonia begins to occur in individuals with autism. The age of onset for symptoms of catatonia tends to be between the ages of 10 and 19 years. But it's entirely possible for an individual much younger to have characteristics of catatonia. So it's important for anyone who has been diagnosed with autism, for people around them to be alert for the onset of catatonia. Let's look at the characteristics of catatonia according to the diagnostic manual, the DSM-5. You'll see here that there is a list of characteristics, and I'm guessing that among those who are seeing this, that there are a number of you who don't know what a lot of these words mean. And what I want you to know is join the club. There are very few people who know what these terms mean. These terms are psychiatric, medical, and tend to be understood just in a small community. That's one of the reasons why so few people in the field of autism know catatonia. It's because the language has been so obscure for us. So one of the things we're going to do in this series is clear up the language and put these characteristics in everyday words so that when those characteristics are present in someone that you know, you'll be able to recognize them. This is a description of the characteristics of catatonia in autism. And Lee Wachtel, who works at the Kennedy Krieger Center at Johns Hopkins, developed this list. This is an important list that we're going to revisit because the characteristics of catatonia are a little bit different in people with autism than they are in other individuals. Just to get started on the characteristics, there are two broad categories of characteristics of catatonia. One is immobility and the other is excitability. So when we talk about immobility, we're basically talking about people being stuck, so that there's a movement that they need to make and they have difficulty making that movement. They may look frozen, or sometimes we use the word in a stupor. They may stare off for a while, or be in the middle of a movement and not be able to complete it. We'll talk more about that. The other side of catatonia is the excitability, and that is when we see people agitated or maybe even doing destructive acts that are out of their control. We're going to talk more about that side of catatonia as well. And the DSM-5 tells us that one of the reasons that catatonia has been so poorly understood is because it has such a confusing presentation. At one point in the day, an individual can be excited or active, and at the other point in the day, they can seem frozen. And all of that's related to the same thing, to the underlying catatonia. We're going to talk more about these characteristics in weeks to come, but just wanted to introduce you to the two sides of catatonia. See you next time.